I'd like to welcome you to our third and final installment in our Lunch and Learn series. Some of you it's Breakfast and Learn, how to write successful grants in prevention. And today on session 3, we're going to really dive into real life examples and analyze and learn from those real life examples. So moving right along, I do want you to know that this training is 100% supported by SAMHSA, the Substance Abuse and Mental Health Services Administration. And what you're going to be hearing today are the views of the authors, and they're not necessarily views nor are they endorsed by SAMHSA, Health and Human Services, or the U.S. government. So the PTTC network welcomes and celebrates our diverse community of professionals, and we really strive for inclusivity that respects the spectrum and identities of all participants. And inclusive language, well, that's the recognition that words matter and that word choice can be used to include or exclude others. And using inclusive language communicates in a way that's respectful and really brings everybody into the conversation. And to that end, the PTTC network uses affirming language to promote the application of evidence-based and culturally informed practices. So what is the PTTC network? Well, if you've been under a rock for the past, a little more than 5 years, 5.5 years, the PTTC network is a network of 10 regional centers funded by SAMHSA. And our goal is to build the capacity of the prevention workforce. We are your tax dollars at work, where we provide free training and technical assistance to the prevention workforce. So the Southeast PTTC is in dark blue here on your screen. We're housed at Wake Forest University School of Medicine in Winston-Salem, North Carolina. And we're under the direction of Drs. Kimberly Wagner and Mark Wolfson. We serve 8 states in the region, from North Carolina and Kentucky all the way down to Florida and all the way over to Mississippi and Alabama. And we don't want to leave out Tennessee as well, and South Carolina and Georgia. So if you're not in the Southeast region and you're not aware of your PTTC, do check it out. The website is pttcnetwork.org. You'll find your center if you haven't already. And don't forget, there's also the Addiction Technology Transfer Center and the Mental Health Technology Transfer Center. So I want you to know that at the end of this training, we will bring up a slide and we'll put it in the chat as well for you to participate in a quick evaluation, also called the GPRA, the Governmental Performance Reporting Act. But we read through all of your comments and we share your comments back with the presenters, and we apply your suggestions and ideas to future trainings and formats. So please do make sure when you close out, whenever you leave this 2-hour session today, or if you hang on till the end, when the session closes or you close out, you'll automatically go to an external site, and that is where you will complete the evaluation. Now, don't be impatient like me and close out as soon as you're done with your evaluation. Give it a pause, because the certificate of attendance will download automatically as a fillable PDF. So you will be able to type in your name and save as onto your screen. If you have any problems with that, I'm going to follow up this webinar today with an email with all of the information. And Darcy said it didn't work last week. Sometimes it doesn't work. Sometimes it does, but don't worry. We'll make sure that you get your certificate of attendance. It is for 2 hours. So, ethically, you need to make sure you stick around so that you can claim those full 2 hours. So yes, this session is also being recorded, and it will be on our website where you went and registered, and it will also be on our YouTube channel. So you'll be able to view it there. If you missed session 1 or 2, they're both on our website, and they're also on our YouTube channel. You can download those and watch them and share them with others as you need. I'm trying to think if there's anything else I need to say about this. We will also provide you the slide deck. I know I'm going to get those questions all throughout the webinar. But yes, you're going to get the recording, you're going to get the slide deck, and your certificate of attendance. I think that takes care of that. At the bottom of our main page, which is pttcnetwork.org/southeast, welcome memory, what a great name. is where you can sign up for our listserv. If you're not already on our listserv, we send out once a month a newsletter with upcoming trainings, not just ours, but we also highlight other things throughout the PTTC network and other partner organizations. So make sure you sign up for our newsletter, and you can also subscribe to our YouTube channel. So you'll get not only these 3 webinars, but webinars we've done in the past. So go check it out. An upcoming event on July 11th, we're having HIV A to Z. It is a 6-hour course. For those of you working on certification or recertification in North Carolina, you're required to have an HIV course. If you're recerting, most of you know it's 3 hours. Mississippi also requires 6 hours of HIV. So this is a really great course. Even if you don't need it for certification, people go through this course. You kind of got to set aside your day. But it is really informative, and it talks a lot about the intersection with HIV, not just in terms of prevention, but also mental health. So I do highly recommend it. So with that, let me get on and introduce you to our 2 presenters today. If you've been in session 1 and 2, you already have met Drew. Drew's the principal consultant. There he is at Common Good Data. He provides data and program evaluation services to nonprofits and the public sector. He advises organizations on how to use data-driven decision-making to design and evaluate effective programs, secure funding, and improve community well-being. Drew also advises organizations on how to improve data and evaluation activities through a diversity, equity, and inclusion lens that attends to the culturally, linguistically, and racially diverse contexts in which many of your organizations function. Now, I'm really happy to introduce you to Carrie Lynn Coleman. She is a former White House drug policy advisor and national substance misuse expert. She has over 20 years of experience in the field of prevention and behavioral health promotion. Carrie Lynn has provided valuable evaluation, strategic planning, and fundraising assistance to nonprofit organizations, coalitions, state agencies, and communities throughout the United States. And she's assisted agencies in securing over $55 million in grant funds. So I'm going to stop my share, and I will encourage you to put questions or comments in the chat throughout. And at the end, I'm going to bring up a QR code for the evaluation, which has the certificate. And with that, Drew, I'm going to hand it over to you. And Carrie Lynn as well. We're excited to have you both here.
Wonderful. Well, thank you so much. We'll go ahead and get started. Okay. So again, today our workshop is called Analyzing and Learning from Real-World Examples, and this is the 3rd workshop as a part of the Lunch and Learn series on grant writing. So if you are interested in getting into the weeds of grant writing and looking at examples of writing and seeing how their strengths, what's going well, but also areas that can be improved, you are in the right place. As those of you who have attended the last 2 workshops that I gave over the past couple of weeks, you'll know that there's a toolkit that accompanies all of the workshops, including this one, and you can download that at commongooddata.com/grantwriting. So I recommend that you download that toolkit. It'll have the information from the last 2 workshops as well as this one all in one place. So we did our introduction, so we'll skip by these real quick. But one thing I will mention about Carolyn and I is that we're both social workers, and so we'll bring that lens for sure when it comes to talking about substance use prevention. I'll also mention that I have a podcast you can check out at commongooddata.com/podcast, and just recently posted one that actually is a summary of the first workshop. So if you want to get another listen of it, but feel like you want to listen to it in the car or something like that, check out the podcast and you'll be able to see that there. So the 3 workshops, just to kind of position where we are today. The first one was planning for successful grant writing, where we kind of talked about all the things you want to do to think about how to start a grant. So where do you find grants? Who should you collaborate with? How do you plan out a calendar over multiple weeks to be able to put together something big and comprehensive like a large federal grant? That was kind of the conversation in the first one. In the second one, we really dug into the details of writing a winning proposal narrative with recommendations specifically for each of those different sections, things you should think about, things you should include so that your narrative can best represent your agency, your organization's work before the reviewer. But that was really more talking conceptually about what should be included and what we should have. However, we didn't get a chance to dive totally into the details of what the text might look like in each of those sections and how we can work to improve them. And that's the focus of today's workshop. So again, download the toolkit at commongoodData.com/grantwriting, and you'll be able to have access to on that website. You'll be able to access a lot of materials for each of these three workshops, as well as the one for today. Okay. I'm going to skip ahead of that real quick. We did some introductions already. So if you haven't, go ahead and add your name and title and organization into the chat. I love to see those, and I know it's a good way to kind of connect with some of our colleagues here on the call. What I love about today is that we've got well over 100 people here, and we've got people from all different parts of the country. And so I know that many of you are all kind of engaged in this work in your respective areas, and this is kind of a good way for us to think nationally sometimes about our work when we're often sometimes very siloed in our own organizations. So welcome everyone from all the different locations that you come to today. Okay, so first we're going to start with looking at some problem statements. And what we want to do is give some examples of what a problem statement might look like and how we might improve it. And the way this is going to go is I'll kind of walk through the context in the question, and then we're going to turn it over to you all to share some ideas in the chat about how it might be improved and some strengths. You'll also be able to see that accompanying toolkit, which will go question by question as well, with spaces where you can kind of jot information in or share some ideas. So, and what will happen is that Carrie Lynn and I will both be able to provide a little bit of ideas and context for each one of these. So first, we're going to talk about an example question, which shows up a lot of times in prevention grants in some context. This one I modified from a local grant in one state in the Southeast. But there's lots of questions that will ask questions about geography. In a sense, who do you serve and where do you serve? So I want us to imagine we're working in a rural county in the Southeast, and that we're applying for a local grant. And the question is to describe the specific geographic area to be served by this project. So for example, the school, workplace, neighborhood, city, countywide, etc. Okay? Now, here's an example from what you'll see in the toolkit. So I think this is on somewhere in the page 20. I can't remember actually which page it's on. But you'll see this section here, and this is where we're following along in the toolkit for those of you who are looking at that as well. And we have the example here. Now, I know most times this will be a little bit longer in your text, but I wanted to make smaller sections of it just so that it'll be easier for us to kind of take a look at the text without feeling like we have to read a whole novel every time we tackle an example, right? So the example states, our programs operate within this county, a rural county serving 60,000 residents. According to U.S. Census data, there are 12,000 youth ages 11 to 17 in our catchment area. In general, our local data suggests that youth attitudes and beliefs, along with a lack of enforcement, lead to increased access to marijuana in the community. We'll focus our programs and activities at middle and high schools in the local school district. Okay, so that's our example. And what I'd like to do, sorry, I kind of stuck behind me there. What I'd like to do is to, in the chat, if you can start to maybe share some ideas about what this example does well and what perhaps could be improved in what you're seeing in the narrative. And I'll give you about a couple minutes to work on that. After we share some of those examples in the chat, I'll kind of summarize some of those and I'll turn it over to Carrie Lynn to share some ideas. And then after that, I'll also dive in with some examples of how it can be improved and some successes. So let's see some examples in the chat. You know, we've got this county serving 60,000 residents. Maybe you've imagined trying to write a section like this for your grant before. What do you include? What do you think would be important to include when talking about the geography and area you serve? All right, we've got some good answers coming in here. So Kitty shares, give actual local data statistics for those risk factors and naming the school district. I really like that one about actual local data being more specific to the local as well as naming the school district. And in this case, I would have done it anyways because it's redacted, but in this case, it kind of like the school district, or even if it's a rural county, there might only be one or two high schools, you can name them, right? Where are the places where you're going to be working? And sometimes it's helpful to get really granular and say, hey, we're going to focus on these high schools or these middle schools versus these other ones, because that's where we see some of the emerging challenges. Kristen mentions that it does have a mix of national and local data. So you have a couple of, because we do, have some data about how many residents are in the county. So you get a sense of how big it is, how many youth are being served in that catchment area is great. Other examples, adding more detail on local information, languages and culture, points of history that are relevant to the problem. I like this one. And Tanisha shares local data in neighborhoods, especially zip codes. That's a great point, right? Because a lot of times, you may be working within a county, but most counties are often, it depends where you are. Some counties in Georgia are actually pretty small, but in some places like Arizona, for example, your county is covering more than half the state sometimes. So, it's good to, be able to use a geography that's a little smaller than a county level when you're able to. Some other good examples here. More specific data describing the catchment area. This is awesome. Thanks for all so much for sharing some of those examples. I want to turn it over for a minute to Carrie Lynn, who's going to provide some expertise here. And after she shares some comments or ideas, I'll go through some points that I put together for this slide as well. So Carrie Lynn, what are some thoughts that you might have on strengths and areas this could be improved?
Absolutely. So I agree with most of the comments that have already come in related to looking at more local data. I agree with you, Drew, that you might want to, instead of just saying we will focus the program and activities at middle and high schools in the local school district, I would say how many middle and high schools, if it's the only middle and high school in the area, or if you've chosen specific ones, and then talk about why you chose those specific middle and high schools, and then give very specifics around kind of the context of those students or within those middle and high schools that you're serving, related to race and ethnicity, languages, numbers served, etc.
Awesome, thank you. I think it's a great point too, because the great thing about schools is that there's actually a lot of information about schools that's publicly available. So if you want to be able to share a little bit about the demographics of the schools and how they may be different within the catchment area that you're working on, that can be a great way to really show that you know your schools and your community really well and trying to communicate that to your reviewer. So here's our example, and I want to walk through a couple of examples, right? So we shared this, some of these examples were dropped in the chat, which is awesome. Being more specific with geography. What makes your county unique? Imagine you're a reviewer in this situation and you're reading 100 of these, right? If you want yours to be memorable, what is it that makes your county really interesting and unique? And how can you stand out to the reader in a way that shares that, right? Here is one thing too that didn't necessarily come up in the chat, but we talk a little bit about the sentence where it says, youth attitudes and beliefs, along with lack of enforcement, lead to increased access of marijuana in the community. Now, that may be a very true statement, but remember the question here is asking about geography served. And so what I would recommend is to save those types of things for the sections where those questions are being asked. And a lot of times when I review grants, I see that sometimes one question is being answered in the wrong section a little bit. It's good information, but it's taking up space. Where here, really, the question is focusing on who you're serving and where you're serving as the primary detail, because the next question goes into substance use attitudes. Sorry. And then as shared too, more details about the schools. Awesome, great examples. This was good. This is a good one. So we'll go on to our next one, and we're going to imagine that this is the exact same scenario where we have the same example from a local grant from a provider in a rural area of the Southeast. And it says, describe the community need or the problem that your project is attempting to address specific to alcohol or substance abuse or disorder prevention, education, treatment, or the research. Here it says, use local data if possible to provide evidence of the identified need or problem. Only use national and state statistics if you are making local comparisons. Okay. So we've seen a question like this before in some form, in some type of grant that you've applied for, federal, state, or local. So let's see the example and how it might be improved. So the example states, the National Survey on Drug Use and Health states that marijuana is the most commonly used illicit drug, with 22% of people aged 12 and older using it in the past year. Data from our state drug survey suggests that marijuana use is highest among high school juniors and seniors. In addition, prescription drug use is a very prevalent problem, particularly among middle school youth. Nearly 2 in 5 youth shared that they knew a friend who used a prescription drugs without a prescription. So, what's going well? What can be improved? Share some ideas in the chat. What is it that you're seeing in the statement need as a real strength? Something that you would say, hey, I do that, and that seems like a good, successful way to communicate that statement of need to a reviewer. In addition, where might be areas of improvement? Chelsea K mentions using a story instead of all statistics. I actually really like this. I was reading a grant the other day that was focusing, it wasn't on substance use prevention, but it was on violence prevention work. And they shared a story of a local situation of gun violence in their community. And it wasn't a raw statistic, but it was a story that rose to not just local, but also national attention and really gripped the attention of community members. And when you can share a story like that along with data in your statement of need, depending on, each grant's different, some will accept that and some you will have space and some you won't. But I think it does a really great job, again, of communicating what makes your place unique and why, in the case of this grant, or why violence prevention responses and prevention work was so needed in a community that was still reeling from that incident of gun violence. So thank you so much for that example, Chelsea. Really awesome. It looks like Jaime mentions this goes into behaviors of death, but what about risk and protective factors? That's awesome. I love that, right? So using a social determinants of health perspective, for example, or just other factors that are contributing to use. Sometimes we get tempted and we just say like, hey, here's our 30-day use indicator. Things are challenging, right? But how can we get beyond that? How can we get beyond just rates of use in the community to begin to add more color and detail and nuance? Nina mentions the date of the survey. Ooh, that's a good one, right? That's a really important one. Whenever you're sharing data, it's often asked that you cite where the data come from. And it's important to include the year because this survey could be 10 years old. And it could be that data on marijuana use is looking very different in the community today than it was 10 years ago. So that's a great example to include here. I know we got some more things in the chat here, but I want to turn it over to Carrie Lynn to share some thoughts too. And you can also, Carrie Lynn, if you want to incorporate some ideas from the chat as well in your response.
Thanks, Drew. So I definitely, whenever I am responding or working with an organization related to substance use prevention needs statement, I definitely kind of start the needs statement with saying these are the substances that are the problem substances in our community, particularly if those are the ones that you're going to be addressing with your grant. So just right off the bat, the most commonly used substances among youth in our community are X, Y, and Z. And then based on how I organize those 3 substances, I provide data to support each one of those. And so think of like a separate paragraph for each substance. So here it jumps from marijuana into prescription drugs, and it's not real clear why. So I would keep this paragraph specifically focused on marijuana. It does include national data and state data, but doesn't include then local data. So if you're going to use national and state data, I would then also compare that to local data. So something like, while the NISDA data says that marijuana is most commonly used, 22% of people age 12 or older using it in the past year. In our community, 36% of youth 12 or older have used in the past year. So you can see that nationally it's at 22%, but our community it's higher. Or you could do that based on the local, the state data and then to the local data. I do like the kind of mixing up like nearly 2 in 5 youth shared. When I use statements like that, or like 3/4 are youth or over half of youth, I then do put the actual percentage from the data source in parentheses, so that it's clear that you've got, what is 2 in 5. It could be 20.5%, or it could be 18%. But make it clear that you actually have data. You're not just throwing out numbers out there.
All great examples, right? And you see, we're seeing some of that reflected in the chat. A number of folks mentioned in here that like the emphasis seems to be too much on the national data. There needs to be more local data, more qualitative data. So this is really awesome. So a couple of points that I'll add in here too that summarizes a lot that's been discussed, but also some of the points that Carolyn mentioned. How can we answer this question a bit more specifically? Again, how is it more unique in your area? How is marijuana a unique problem? Adding some of those details, adding some of those risk and protective factors that talks about it in a unique way. One thing I'll mention here too is that many of you mentioned the issue of national data. I do think there's also something we can do in our writing that talks about what is the most important thing that comes out of this, right? And in the question, I'll go back to it actually so we can see it real quick in the last slide. It says very specifically, only use national and state statistics if you're making local comparisons and to use local data. And the first sentence of this statement of need is an example of national data. And it looks like you're not quite reading or responding to the question in the right way. You can still use national data, and to the point that Carolyn made about making that comparison, but you should forefront the local data. Forefront what's unique about you rather than what you see kind of nationally, right? And also to the point around organization, Carolyn mentioned the idea of having different paragraphs. In this section, we go straight from marijuana into prescription drug use without much explanation or really an understanding about the linkage between those two things. And it may be that the responses in this grant's action plan are very different for those two substances. They probably are. So in those opportunities, it's usually good to have some type of organization. One example that Carolyn mentioned was stating which substances you're going to focus on in the first sentence maybe, but then having separate paragraphs for each of those to talk about what's unique about marijuana use in your community, what's unique about alcohol use, prescription drug use, and so on and so forth. Awesome. Some great examples here too in the chat. So thank you all so much for sharing some of those.
Yeah, so Drew, let me jump in with a response to 2 of the most recent notes in the chat.
Yeah.
So the point about being a rural or underserved context, it's important to note that there might not be thorough local data. That's absolutely true. And so if that is the case, you can state that in the proposal. So you're going to say, state data says this, while we don't have a local survey data specific to substance use, we know that X number of kids were suspended from school for marijuana use last year. Or, you're going to use you may not have a school survey data, but you will have you're going to need to have other data to support the need in the community. So look for, suspension data or arrest data, juvenile, delinquency data, even data related to kids who have been referred to other programs or your particular program in the community with a substance use issue, so that you can definitely include local data, but state that there may not be a particular survey in your community. And then the other note was that, what if there's no section explicitly soliciting a need statement? So that's an interesting question. I haven't seen too many that don't explicitly request a need statement, but I would say then if they asked, omit the section, or where would you, the place to put it, such as the project narrative. I agree that it would probably go in the project narrative. So if you're in the narrative, you're putting in, what you're planning on doing, you're going to want to refer to why you are planning on doing whatever activity it is that you're proposing in your application. So that's where you would state the need.
Yeah, agreed. And great questions there too. So thank you, Ali and Amber, for sharing those with the group. One thing I will mention as a strength of this statement of need is that it does share 3 different examples of data, and it doesn't come off too like stat, stat, stat. Like there is a bit of narrative to it that you can kind of follow and work through. And so there's a lot of strengths from the statement of need, and the examples we're giving here are ways, how can you go back to it and improve it? You could take something like this and tweak the first sentence to focus on local youth, add some more details, talk about risk and protective factors, and this could be a real strong statement of need. So let's tackle another one. We're going to go with the same example of working in a rural community setting in the South or Southeast. And this time we're going to change it to a Partnerships for Success grant, which I used, I think, some examples from one of the prior workshops on for this one as well. And so this one is a bigger federal grant, and so it's going to have a little bit more detail to it. And I'm going to share with you just one section, one paragraph from one of a grant application for this PFS grant. And again, share strengths, areas for improvement. The focus of this question says, document the need to help reduce the onset of the progression of substance misuse and related problems by supporting the development and delivery of community-based substance misuse prevention and mental health promotion services in the proposed catchment area. Include information on service gaps and other problems related to the need for infrastructure development, and identify the source of data. Okay, this one is much longer, so I'm not gonna read it out loud. This will be the longest example that I'll provide, I promise. We won't go too far in detail. None of the data in here are true data, so this is a fictitious example, but I'll give you all a minute or so to read the problem statement. This is coming from the 3rd paragraph of a statement of need for a PFS grant. All right. So perhaps you've had a chance to read through it, maybe a little bit quickly here. So what are some comments that we can share? Again, what are some strengths that you're seeing? What are some ways that this problem statement could be improved? And let's take a look at some of the examples coming in. Darcy mentions the gaps are intended services. That's a great point, right? Because it really did specifically mention here, what are the gaps in service delivery? Now, I think in this grant application, it may have showed up in another paragraph, but I think to that point, when it's in the question, it can be really helpful to reiterate that point in different sections of your things and not to stray too far away from that need. Yeah, and another example there too about infrastructure needs, gaps in services, being more clear about what the alarming trends are. Excellent, good. Other thoughts or other areas of strength that you saw in this one? Some good examples coming in here. So Darcy mentions, that it does identify data locally. It's more of a concern than county and state level. So kind of like what we talked about in that last example, you've got the data at the local level being forefronted, but also showing that how that's being compared to county and state levels. That's a real strength. Nina mentions using bullets for readability if allowed. That's interesting. I think that there are some opportunities in your grants where you are allowed to use some bullets or organization in such a way that makes it a little bit easier on the reader. My experience with federal grants has been that because you have to get a lot of information in there and you only have 10 pages, that space might be an issue with that. What are your thoughts on that, Caroline, actually? Have you seen people use bullet points and other ways to kind of organize it to make it easier for their readers?
Yes, I do like using bullets and tables and charts where there's space allows, really, because and also specifically to when you're looking at a need statement, if you're going to use a table or a chart or bullet points, I would definitely, it needs to kind of, not bullet points, but the table or chart needs to support the narrative. So it has here like table 1 presents these data. I think narratively describing it and then putting it in a table. If there's space, I think that's great. I've used bullets more in like success, like, so it'll say, you know, this would be later in the application, but it'll ask, you know, lists the accomplishments that you've done. And I like using like little check marks and then writing the success, because it kind of is a visual cue that like, hey, we accomplished this, and then it has the information. But space is always the issue when you're trying to make, you know, formatting decisions.
Yeah, interesting, right? Yeah, so I think there probably are ways you can be creative with how you're writing your narrative to include these. This one did include a table, which I don't have here just for space reasons. But, you know, whether it's including a table or using bullet points, having check marks or other ways, using visual cues can be a really great strategy when you're trying to make it easy for your reviewer to understand the points that you're trying to highlight. I think another couple of good examples here too, talking about things like adding in numbers for suspension rates. Where does it lead to? Because it really focuses on citation here in terms of what are the numbers of youth who have had an experience of being involved in the disciplined student within their school, but there's not necessarily a connection to that, to the suspensions, at least in the narrative. It does show up in the table, but it's not in the narrative. So that's a good detail to highlight there as well. So let's go ahead and take a look at some things that are strengths of this, and then and again to put that in context and conversation with what's in the chat. So some strengths, the data are specific and local, again, in comparison to some of the prior ones that we saw, and how the problem disproportionately affects some schools more than others. So again, getting more specific, being specific within a large level, like a state or a county, to more of, you know, a school zone area, a zip code, a census tract, right? It adds some context. One here, I think a strength is that it talks about the school's no tolerance policy, right? Because not all schools approach discipline around substance use the same way. And some schools, you know, may be in a situation where their particular policies may lead to disproportionate discipline for some of their students. That's not to say that that no tolerance schools policies is something, I'm not here to comment on whether or not those are a good or not a good policy for schools, but that context may be connected to the reason why we're seeing high suspension rates in those schools. In addition, there's a theoretical framework that talks a little bit about where I said STPP, the school to prison pipeline, that there is something that helps to try to put a narrative to explain what you're seeing. So what is, and not just so much that we have data on 30-day use, and we have data that youth are accessing alcohol at, you know, retailers in our community, or at, you know, social events at school or things like that. It's more like, how can we use some type of broader theoretical narrative that helps us understand or make sense of a challenge. School to prison pipeline is appropriate here because we're talking a little bit about the connection between substance use and involvement, not just in school discipline, but later on in justice involvement. In addition, you can use other types of theoretical frameworks. I've seen some people who write really compelling problem statements that use a lens that's focused on ACEs, for example, using ACEs as a broader framework to understand the connection between experiences of childhood neglect, abuse, and other forms of ACEs, and the prevalence of substance use in the community. I've seen people write really great problem statements that take a strong diversity or equity lens to what's going on in their community and use that as a framework as well. So that can be helpful. You don't want to do too much on it. You're not writing a novel, right? But having a little bit of a theoretical framework, I think, can be helpful. Before we go on to our next section, Carolyn, any other comments or thoughts on this example or things you've seen in the chat?
I really like your point about the theoretical frameworks, and I have seen both ACEs be used, and particular like demographics of a community, or and highlighting how those particular demographics set them up for more challenges. So I agree with framing things in a larger framework.
Yeah, and I think, you know, we talked in one of the previous workshops too about integrating sometimes examples from peer-reviewed literature or some research. so that you can mix local data from with a study that might look at something very unique. And the example I gave was a paper that focused on acculturation stress for immigrant and Latino communities and how that can sometimes give rise to substance use. So having some of those theoretical frameworks can help explain, what you think you're seeing when you're looking at local data in your community. All right.
Which I think also helps set up what you're going to choose to implement. So when you're using those frameworks, you want to use them in the context of, this helps describe the problem and helps set up why we're choosing the particular strategies to address that problem. If there isn't that connection, it's not as helpful. So be thinking about when you're choosing that framework or those studies or research about how that gives credence to what strategies you're going to be implementing with the project.
Yeah, so I'm really glad you mentioned that because, in this case, if we're kind of focusing, for example, on school discipline policies and involvement in justice systems, a good thought in terms of a response may be to consider, hey, how can we incorporate in a Partnerships for Success grant where our intention is to build partnerships across sectors, right? How can we get involved with, for example, youth, juvenile court systems, teen court systems, and some of those other organizations within the justice system that are working on finding ways to divert youth who may be experiencing addiction or having some other challenge related to substance misuse away from, more on the lens of incarceration side of things and more towards, treatment and support and case management to help treat the underlying conditions that gave rise to the reason that they're there before the court that day. So you can kind of see how it would make sense. Now, it probably wouldn't make sense to have all this stuff on the school prison pipeline and then not talk about school discipline or not talk about the court system or something like that in your action plan. So great point, Carolyn. I'm glad you mentioned that. All right, before we go into our next one, there is one question here that I think is a cool one to address where we have, do you think we will ever get to a point where we can submit videos instead of a written grant? I have actually submitted a grant with an organization that did have videos as a part of it, which was a really interesting experience. It was the first time I had ever done something like that before and was really interesting. I do think I'm actually not sure how I feel about it because on one level, I think it could be really helpful for organizations, especially for people maybe who don't feel like, maybe the grant writing process weighs too much on the skill set of writing as a medium of communication. And maybe, some organizations would do a better job communicating themselves through video. I'm not sure. Carolyn, what do you think about that?
I agree. I think it's interesting. I have not seen it done, so that's interesting that you've seen it done, Drew. I would be surprised if the federal government went this direction. I would see it happening more at the local, foundation level where they're, just are receiving fewer grants, and so it's easier to have kind of a diverse way to receive those grants and the information. I also wonder. It's an interesting thought related to how different communities have strengths and weaknesses. So some communities have, or organizations have a great writer. So responding in a written format serves them well, where others may not have a great writer, but they do have a great tech team and they've got kids who are super at, making videos and really telling a story through video or art or some other way. So yeah, it's an interesting concept I have not seen actually implemented. So
we'll have to see. I don't know. I'll keep my ears low to the ground. I could see all kinds of issues, both pro and con on that one. So we'll have to see. All right, so let's talk a little bit about action plans. And so in this one, we're going to focus primarily on goals and objectives. We shared some examples in the last workshop on this. But to really focus a little bit on where do we see, what are some of the characteristics of strong goals and objectives and how we can put that into writing. So in this example, we're going to shift our context and we're going to start working in this time in an urban metropolitan area in the Midwest, who is also applying for a Partnerships for Success grant. And this is a question from the most recent one here where it says, describe the goals and measurable objectives. And they do have a great appendix, actually, which I highly recommend reading. If they ever say there's an appendix, go in there, read it, and make sure that you're following the directions that are outlined there. So see the appendix C of your proposed project and then align them with the statement of need outlined in 8.2. Okay. So let's take a look at our goals. And as a reminder, before we go to evaluate some of these goals, I screenshotted this one from the funding announcement as a definition of what a goal is and the characteristics of effective goals. And this is just so important. Every time I look at another funding announcement, if they give you any clues about how they want a goal or objective to be written, whether it's a federal, state, or local grant or a foundation or whatever it may be, always look about how they want you to write goals and objectives, because lots of organizations will approach how to write a goal and how to write an objective a little differently. A lot of the same principles apply, but they might approach it a little bit differently. And so in this example here, we have goals as addressing outcomes, as addressing behavior change, describing who is going to be affected by that project, how it's leading to measurable results, and that they are concise. So those are kind of the characteristics of really strong goals. So we have an example here, and I took a screenshot here from the from the toolkit, so as if for those of you who are following along in the toolkit, where you can see the example of the goal, and it's got outcome, behavior change, who affected, measurable, and concise. Again, those same 5 characteristics that SAMHSA gave us as to whether or not, what is the criteria of a strong goal. And maybe you can take some time to jot notes for yourself in there, or if you want to drop them into the chat to share about your thoughts about this goal, strengths, areas for improvement. So the goal is written as launch a social media campaign on TikTok and Instagram with community partners, including the local YMCA, to reach the community to discuss topics about mental health stigma and systemic racism in the juvenile justice and other systems. So that's our goal. So I'll give you all a minute or two to take a look at that goal and share some thoughts in the chat and take notes on your own. Does this goal address an outcome? Does it address behavior change? Does it discuss who was affected? Is it measurable, and is it concise? So we have some information coming in here from the chat. Jaime mentions that it's not too specific. It talks more about the how than the outcome. I think that's a great point here, right? So if you're launching a social media campaign, what is the change that you hope to see in the community? A way that I like to phrase this is kind of like rephrasing the statement of not what I'm going to do as a provider or organization, but rather what's the community going to be able to do as a result of the grant. So community members will be able to do this because this social media campaign has occurred. So that helps us then frame it as what changes. What can I now do if I see this social media campaign? Are my opinions about the risk of alcohol, for example, going to change? Are my thoughts about stigma that I might feel like I might experience if I seek assistance with mental health going to change as a result of this campaign? So Jaime, a great point there around the outcome. Chelsea mentions too around timing, right? So for how long isn't exactly stated in here in the goal. Very good. I think too, well, that's a good question. And I would love to kind of have a further conversation about where we start to get very specific around timing. Because we're going to see in the section when we talk about objectives where we use the SMART goal framework and having things be time bound, that it may be that we accomplish that through the objectives, but we can revisit that conversation here in a section. Some examples about it's not measurable, more details about the type of campaign. That's a good point there too. So is it a social norms campaign, for example? Difficult on how it can be measured. I find that it's really challenging to be able to measure the effectiveness of social media campaigns. Really what we're pretty good at measuring, if you work with a marketing team or maybe you have that assistance internally, you can track the number of likes, reposts, impressions, how many people that your message meets, how many people saw your billboard. Using the same types of industry metrics that you might see in a marketing campaign. But, ultimately, the ultimate outcome from that is a change in some type of behavior. And measuring that on a community level can be really challenging unless you've got a really strong, robust local survey of attitudes. So those are some great questions there. I'll turn it over to you, Carolyn. What are some other things that you're seeing in the goals or things that you've seen in the chat that you think might be a good points to bring up regarding this goal?
Yeah, so I do think that people have all kind of hit on it, that it doesn't seem exactly like a goal. I think that when I read this, I come away thinking, okay, so what they actually want to change is, or see, is a reduction in mental health stigma and systemic racism in the juvenile justice and other systems. So the goal could be reduce mental health stigma and systemic racism in the juvenile justice and other systems. And then a objective would be, or an activity even, would be the social media campaign. So that's the activity that is going to be a part of reaching your goal of reducing mental health stigma and systemic racism in the juvenile justice and other systems.
I love that example, right? I think sometimes I get caught up in this when I'm trying to write these. We think about what we're going to do rather than what we're going to change. And the big thing that we're going to do, we're going to launch this new evidence-based program. We're going to do this new action campaign. Sometimes we get too focused on that. And that's actually an objective that helps you reach the larger goal. And, the way you said it, Carolyn, was meets our fifth criteria here about making it be concise. This is a very long goal. I think we got 3 lines here. We got tons of words. And you reduce it to just reducing mental health stigma and systemic racism, right? And sometimes by having that simplicity, we look at it and we're like, oh no, that's not complex enough. It's not detailed enough, or we need more information to impress our great reviewers. But sometimes when it comes to goal writing, concise is the way to go. So I really appreciate that example. So I have a few points here that I'll discuss, right? So as shared in the chat, the outcome was not mentioned. It says like it's discussing topics. That's not really measurable, right? So what is the behavior that's going to change? What's the change in behavior or the condition? What changes in the community as a result of it? It should say a little bit more clearly about who the target audience of the campaign is. Although I think actually I would change this now. I put this down saying we should change it to target audience. I like what you said, Carolyn, that we should actually pull that out. And, in terms of the audience of the social media campaign and put that in the objective. But maybe speak in more broad terms, are you focusing this campaign on youth or parents or on, a specific community? That should probably be stated somewhere in the goal. Measurable results, again, the same point as point 1, and then being concise. So great points, great conversation. Thank you all so much for the participation in the chat too. These are just really great ideas and helps us all kind of look at them. Because, Carolyn, I do this all the time, but we're going to miss things too. Like having multiple people look at it is just so helpful. So I really appreciate the contributions in the chat. Okay, so I think we're going to skip this because we have. How are we doing on time? Yeah, let's go ahead and skip it for now. I was going to have you all draft your own version of it, but I think we can skip that out for timing purposes and kind of keep moving along. Okay, so here's another one. Goal 2. A little more concise this time. Provide wraparound services for justice-involved youth to reduce youth substance use. So using those same 5 criteria as before, right? Sorry, I don't have them listed on here. It was, let me go back a slide so I can grab those, right? So outcome, I'll type into the chat so we have outcome, change in behavior, who affected, measurable results, and concise. Okay. That way it's in the chat so you can refer to those 5. So again, the goal is provide wraparound prevention services for justice-involved youth to reduce youth substance use. What are some strengths that you see in the goal? Areas that can be improved? How might you use the criteria given by SAMHSA to evaluate goals to see whether or not these goals are effective? As folks are entering things in the chat, one thing that I'll mention with goal writing is that I have found that it is often the most difficult aspect of writing a grant. And it's also the one where it's actually sometimes the hardest to find consensus among folks that you're working with, because we really want to focus on getting the wording just right. And also making sure that it's complete and that it's representative of everything that's going to happen in the grants. Thinking back to our workshop on planning for grant writing, once you have those partnerships in place, one of the first things you want to work on is what are the goals going to be, and how those are going to be connected to your problem statement, because it can sometimes take a couple of weeks, a couple times of getting out the red pen and editing and fixing to get those goals to really look like the way you want to. All right, so some examples coming in the chat. So defining what wraparound services may be used, when and for how long. And I think I agree in principle to the idea that you need more detail there. I don't know if it has to be in the goal. It may be that you can provide more detail about your wraparound services in the narrative later on, because if you add a lot more detail around wraparound, you're going to lose the goal of being concise in your statement. So it may be that you're able to accomplish that elsewhere, but I think to your point, it's a really good idea to have some description around what those services are going to look like, so that it's clear what wraparound means, because that definition in particular can vary quite a bit by context. What are the measurable results? Excellent. Good example there, Lindsay, right? So what is going to change as a result of these prevention services being provided, and how are you going to measure that? More examples there. Tammy and Claire both have measurement in there as well. Joyce, I'm glad you mentioned too this notion of baseline, right? A lot of times when we're sharing data, the important thing to be able to communicate is where you currently are and where you want to be. Now, in the case of this grant opportunity, maybe there are no wraparound prevention services for justice-involved youth. But having some way to state that, whether it's in the goal or at least in the narrative somewhere, is going to be important to communicate to your reviewers. To say, hey, we're starting something from scratch here. You might also be in a community that has existing wraparound prevention services, but they aren't reaching the right community, or they aren't reaching enough youth. And so you might say, hey, we were able to provide 100 services last year. We want to do 200 next year. Having some details on that can be really helpful. Interesting. Nina mentions it's not aspirational. I think that's really interesting too, because we do want, you're competing, right, with a bunch of other people who are applying for these federal grants, and you want to be able to show that what you're doing has at least some degree of creativity, of novelty, of approaching an emerging pressing issue in a unique way. What are your thoughts on that, Carrie Lynn, actually, on aspirational? What have you seen as a reviewer or when you're working with others on grants, and how do you coach people to think about bringing a sense of novelty or aspiration to their goal writing?
As soon as I saw a comment in the chat, I was like, oh yeah, that is a nice way to think about just the whole application. That often, particularly when you start with a problem statement, you're like trying to impress upon the reader that you've got a real problem you've got to address. And then this is the opportunity to kind of change the narrative and say, okay, this is a problem, but hey, we are the group to address that problem. So I like the idea of being aspirational, and in the goals section is the place where you can be aspirational, of course, within reason. You don't want to go so far that they're like, there's no way they're going to be able to do this with $100,000 in 3 years. So aspirational with a kind of positive approach versus aspirational to be unrealistic. So I do like that idea. Other thoughts about this, I agree. I think some of the things that folks are talking about. So instead of just saying provide wraparound prevention services, Drew, you mentioned, are there wraparound services already there? So I would I like to use words like increase or reduce. So you would say increase the provision of wraparound prevention services. Is that the goal? Is the goal to increase provision of wraparound services, or is the goal to reduce youth substance use? So again, if the goal is truly to reduce youth substance use, then providing wraparound services could again be an objective. If the goal really is, no, we need to get wraparound services because there aren't any in this community, then it's increasing or implementing wraparound prevention services, maybe with a little bit more specificity.
Yeah, I think that's a great point. Again, like, leading with the most important thing to answer the question. So even if you flip the sentence around to say reduce the youth of substance use through the provision of wraparound services, can sometimes again communicate to your reviewer that you're really focused on that outcome. One question that comes up a lot, Carolyn, I'm actually curious about your perspective on this, is when you're writing goals, sometimes some people want to organize it almost by substance area. So they'll have, maybe there's 3 or 5 goals in a grant application. They want to have one goal for tobacco, one goal for marijuana, one for alcohol, for example, just as an idea. And there's some strength to that because a lot of times your strategies are kind of unique to those specific ones. But then you run into the challenge of situations where you're providing services that are really going to reach multiple different aspects of substance use. In the case of providing wraparound prevention services, it would hit all 3 of those substances likely. So how have you seen organizations kind of organize their goals? Do they use the substance area as a way to do it, or different ways of? I'm just curious about your thoughts on that.
I definitely think that the different substances play with objectives, because you can say this is the baseline and we want to increase or decrease the rate of use. And the problem with like lumping alcohol, tobacco, and marijuana into one goal, and then putting the baseline and then putting percentage of change, it could get to be a gigantic goal. It would just like space-wise, and it's just kind of too confusing. But in addition, it's really, then you either meet that goal and because you've been successful in addressing all 3, or you don't meet that goal because maybe you weren't successful in reducing tobacco, but you were really successful in alcohol and marijuana. So I do like breaking out the substances so that it's very clear, not necessarily in goals, but at least in objectives. I would not put multiple substances in one objective, because then you can kind of trap yourself in not being able to identify and celebrate the success you might have had related to one substance when you weren't maybe successful in addressing another substance. But I agree, then it gets challenging when you're doing comprehensive prevention strategies that are going to address all the substances. In those cases, I often will repeat the activities multiple times, like under each substance, or kind of create a more catch-all objective. So these provide wraparound prevention services could be its own objective. And then you can put in those strategies that are going to address all the substances under that objective.
Gotcha. Yeah, I think that's really interesting. And I know that many of you who are out there today thinking about, previous grants that you've written probably have wrestled with a question like that. Like, what do you say your goals are, and how do you organize those in a way that's meaningful? And so I think, we had some good conversation on that here today. So as a summary, in this example for goal 2, the outcome is mentioned. So that's a good thing. It mentions reducing youth substance use. And we do see a change, and that could be a bit more specific. Maybe we go on a specific substance here. Maybe you want to talk about a baseline in detail, but at least you have it mentioned, right? Who will be affected? It does say that it states justice involved, but maybe it could be more specific what is the age range of youth being involved, for example? Measurable results, but what can we add here to add some detail to make that more measurable, more clear about what our baseline or long-term objective is going to be? But at least this one's concise relative to the last one, right? So some positives there. So again, lots of these goals, they've got good things, they've got challenging things, they have ways they can be improved. It's not always so easy in terms of yes or no on a good goal, right? Okay, so now we've got some goals. Now let's going to try to go into some examples of objectives. Now I'm going to take goal number 2 and we're going to say it's good enough, right? Or at least that's the general goal that we're working with here. And let's go into the objective. So the first objective we have here says to train program staff by covering costs for travel for an annual conference. Now in the toolkit, you'll see I've got it listed out there too, the SMART goals approach, right? So we want to make sure that our objectives per SAMHSA's recommendation are specific with the S, right? They are measurable, they are achievable, they are realistic, and they are time bound. so that's kind of the framework we want to use. Actually, I remember in our last presentation, someone had also mentioned calling them a SMARTY goal, right, where they talk about equity and inclusion as a lens to it as well, which I think is an important thing to keep in our mind. I use the SMART one because that's kind of what SAMHSA gives us, but to be keeping that equity framework, I think, is important when we're approaching objectives. So when looking at this from a SMART goals or a SMARTY goals perspective, what do you see in objective 2.1, where it says train program staff by covering costs for travel to an annual conference? What might you change? What's positive about it? You know, where can be updated? What can be changed? So we've got a couple of things coming on in here. Maria mentions that it's an unclear relationship to the goal. I'm really glad you mentioned that here, right? Because in the objective and the goal, we've got this training program staff by covering costs to travel to an annual conference. Well, can we be more specific maybe about what that conference is and how that conference would be linked to this notion of providing wraparound prevention services? Now, it might be possible to accomplish that linkage in a really strong narrative that's attached to these goals and objectives, but whenever you can make that linkage more clear to your reviewer, I think it's a good idea. So good example there about making sure that the objective that you're saying is clearly helping you accomplish the goal as written. Having more detail about travel, lodging, and specifics, says Mackenzie. I do think that you could add a little bit more specifics. Some of those, though, I don't know if it would necessarily have to go here. So, for example, you know, if you're talking about travel and lodging and the details of what would be covered, I think you can accomplish that probably in your budget and budget narrative. You might not necessarily have to be that detailed here about what specifically you're going to be paying for. But you could also say, you know, it wouldn't be too hard to say by covering travel and lodging costs for the annual conference. You could probably add that in, I think, too. Mentioning the type of training and the outcome or the content of the training, I think, is great. Very good. Nina shares how many staff. That's super important. So exactly how many are you going to, is it 5 staff? Is it 50 staff? There's a big difference there, right? So how many staffs are going to be included? So that's our first example here. How many program staff? Well, before I go through these, though, actually, I got to turn it over to Carolyn to give you a chance to add some details. What else would you add or comment on to improve objective 2.1 here?
Right. So definitely the time bound. There is a, you know, is it in the first 3 months, in the first quarter, within the first year, by a particular date, needs to be there. How many staff, what conference, and even, I mean, you could go a step further and instead say increase staff capacity to, you know, implement wraparound services by attending XYZ conference. So it's much more focused on what are you accomplishing, you're increasing staff capacity. So that's another way to think about it.
Yeah. One other question too that I'm really curious about your thoughts on, Carrie Lynn, is how do you handle objective writing when you're going to have a recurring activity? So say, for example, the goal here is to have program staff attend the annual conference in their field or they go this singular conference on an annual basis, and they'll have 2 or 3 people go. How do you write that to be time bound? You know, even though it's occurring maybe once a year for 5 years.
Yeah, so in that case, I would say, you know, so let's say it's a 5-year thing. So by what we would be 2029, October 2029, if you're writing it this year, increase program staff capacity to implement wraparound services. And then the annual conference isn't actually mentioned in the objective, but it's an activity. X number of annual staff attend the conference. And then you would obviously also then say, how are you going to measure that increase of capacity? So in the objective, so by October 2029, increase program staff capacity to implement wraparound prevention services as measured by I guess it would be some kind of capacity measure. I would, on the spot right now, I would have to give me a minute to think about how you would measure it, but I
Sure.
would usually put how you're going to measure it in that objective.
Yeah, I think that's a great point, right? So having some of that measurement piece in place, and that's something to be thinking about when you're writing your objectives, because many of you, when you're, especially for the federal grants, for the DFCs, the PFS, those type of grants, you're typically going to be having activities that span over a 5-year period. And so you want to be thinking about, how do you maybe you shared the what you're going to accomplish on an annual basis, and then you say you'll do it for 5 years, or maybe you share what you're going to do over the 5-year period if it may vary year to year. Say you want to, maybe you're providing a program, an evidence-based program, and you want to reach, 150 youth and their parents in a 5-year period. Maybe it's better for you to say 150 youth over the 5-year period, knowing that the first couple of years as you're getting started, you might not hit your annual mark of 30, but by the end, maybe you're overshooting your average of 30, youth a year or something like that. Another good question here. Brandy asks, what would happen if you do not know which conference yet? And I think that this comes up a fair amount of times. If you're still trying to decide which of 2 evidence-based programs, and maybe you want to get more feedback from your community before you decide that, or you're not sure which conference to go to. Carolyn, what are your thoughts on that? Like, how specific do you have to be in these objectives to be able to communicate that you know what you're planning for, but you need to have some flexibility around that implementation?
Yeah, so oftentimes in that case, particularly around like providing capacity building activities for staff, I'll say things like provide opportunities to increase skills around topics such as, and then you can put a couple of them, or attend at least one skill building conference around whatever particular skill you want to build. And so you don't have to name the particular conference unless it's, what conference you're going to, and by including that conference, it's going to be helpful to your application.
Yeah, that's a good thought. Yeah. Awesome. Well, we got some good questions, more comments. Last few points I'll mention on here. We mentioned needing to number the number of the staff and track whether they met their objectives. On the plus side, in terms of the strength, this is a very achievable goal. And it is also very realistic in terms of the timing and whatnot, so that it hits those things, but needs more description around timing. Okay, let's take a look at another objective. So this one is objective 2.2, and it says by September 30th, 2028, provide case management referral services to at least 40 parents of justice-involved youth. So using that same SMART or SMARTY framework, what are some strengths that you see in the objectives as stated here? What are some ways it can be improved? By September 30th, 2028, provide case management and referral services to at least 40 parents of justice-involved youth. One of the things that I struggle with when working with organizations is sometimes how to word it when you're providing services at a family level, right? Because you're trying to count the number of people you serve, but like the number of parents for the number of youth is going to vary when you're doing that cross-generational work. It's very easy to say, hey, we're going to serve 40 youth in an after-school program because you can count the number of youth who are there. But when it comes to parents and families, how many parents, how many youth, what about their siblings? What about families who don't meet maybe traditional definitions of family, quote unquote? So that those kinds of conversations can sometimes be a little bit harder when it comes to measurement. So that's one thing that I know that you have to be thoughtful about when putting it together. So let's see here. We've got a couple of things coming in the chat. One where it says dates and numbers, but no identification of services. Yeah, so I think that's an interesting one. And the challenging thing with case management and referral work can be, how do you describe the nature of that case management referral services? And this could probably come out a bit more in the narrative later on in this section, but it might be difficult. I think that's particularly difficult because you might be referring to all kinds of things. You could be referrals to health, mental health support. It could be basic needs and housing support. It could be educational services report, job training. I mean, the number of things that you could list on referring families to could be quite large. So having some detail about the types of services and relationships that you have where you feel like you could do successful case management referral work would be important to include here. Other thoughts? Carolyn, I might turn it over to you here to see if you have one or two thoughts on this, and then I can go through our checklist of things to consider.
Yeah, I think this one is a pretty strong objective. You could provide a little bit more, like a specific, like if you're using a specific EVP or some specific strategy in order to do the case management referral services, you could specifically refer to that. As you mentioned, families look different. So instead of specifically saying parents, you could do parent/caregivers so that you're a little more inclusive there. But otherwise, I feel like this is a pretty strong objective.
Yeah, I like how you mentioned, having or maybe mentioning a model of case management that you're approaching, because there are different ways you can do that. And I think that's also true too with respect to if you have unique modalities, if you're providing mental health services in some capacity, to be specific about that can, again, add strength, to really show that you've got that expertise and approach put in place and thought done before you even receive the grant awards. So going through our checklist here, it is specific, but maybe something a bit more about the type of services in the action plan also included. Measurable, yes, but it could be adding some details too about how you might measure those outcomes. So for example, what is that you hope changes for the parents of justice-involved youth? Are they able to do what better? Sometimes it's hard to get all of that into an objective. Maybe you have a separate objective that's related to how they might respond on a post-survey, for example. But something to be thinking about is what changes for the parents when those referral services are provided. Certainly very achievable and realistic, and we have that time-bound aspect of September 30th, 2028. And I see a lot of September 30th in applications because, as you all know, who've done federal grants, that's when the fiscal year changes over to the start of the new fiscal year. So you'll see a lot of September 30th if you're thinking end of the year type timelines. So, all right, awesome. So let's go into a little bit on evaluation. So we've done our action plan section here, and we're going to imagine that we have a grantor who has put together some performance measures that they're going to have in their evaluation plan. Now, I'll talk a little bit about this chart. There's lots of ways that you can approach your evaluation section, and they're not very long. Sometimes on federal grants, you only get a page or so to really talk about all of these things you're going to do and to include an evaluation. So it's actually really difficult to list every single thing that you're going to measure. You probably won't be able to include everything you're going to measure and how you're going to measure it in one page on a federal grant. But I do recommend highlighting the most important outcomes. So what are the ones that you think are going to be like, hey, this is really going to show how we have been successful? So I took an example performance measure table and modified all the numbers and some things here to share with you all as an example of what you might see. So we've got a table at the top here. It shows the first column is objective. These, you can't see it here because it's out of context, but these would be linked to the objectives in the action plan. So objective 1.3 is the third objective under goal number 1, or the first objective and the fourth objective under goal number 2 for the second example there. So that's what that refers to. Sorry, man. There we go. Then you have what's the primary data collection source and performance measure. So what is it going to be measuring and how it's going to be done? Your frequency shows when it's going to have an example there, or when it's going to be done. This could actually have some more detail to it, probably. Who would be responsible in terms of the staff, and then what types of analysis would be done with that data. So this is an example of a performance measure. Again, you don't have to do it this way, but it might be one way to approach it. What I'd like for you all to do, and for those of you who've been adding things into the chat here to do the same, is to think a little bit about how these performance measures could be improved. And I think particularly in the second column here, where we have these details. So the first one, alcohol purchase survey of 36 stores in our community by 2027. An evidence-based program of youth survey decreased the number of youth reporting using alcohol at home from 88% to 70%. You have So some examples there to take a look at. So what are some things that you can add in to improve some of these performance measures based on what you're seeing? One of the things that I think when I work with organizations that I see is the hardest thing to do is to really have a good sense of what your baseline is on some outcome or indicator and what you think you can realistically change in 1 year, in 3 years, or in 5 years. I'll talk to folks and we'll put numbers out there and we'll say, do we think we can really do that? And do you think you can do this or do that? And if it's something you're doing that's new, you might not have a lot of data to show, looking back at your own history, can you point to examples where it was like, hey, when we started this new program, we were able to reach 100 youth in 2 years. But if you don't have that, it can be kind of hard to estimate some of these. So let's take a look at some of the examples coming in the chat. Melissa shares 25 to 5% is a lot. I'm glad you mentioned that one. Good, right? To reduce high school 30-day vaping use from 25% all the way down to 5%, and this is an example in maybe 3 years, would be an enormous change. I mean, you would be getting national headlines if you were able to accomplish that, I think, because that would be probably an unachievable goal. Or if that did happen, it would probably come with a confluence of other factors. We did see a pretty precipitous drop in vaping use when the tobacco age changed from 18 to 21 nationally. But that wasn't because necessarily of what we all were doing on a local level. That happened a lot to do with national changes in national law, right? So I think that that's an important thing to keep in mind. What can you reasonably say, hey, we think we can accomplish this based on what we're able to see. But to that same point, what can be hard when we're looking at specifically, or in particular, when we're looking at evaluation of population level change, having some degree of humility as to what a coalition, for example, might be able to accomplish, because you're one factor in many factors that impact substance use in a particular community. And it could be a lot of other factors that could increase or decrease things in the community based on what else is happening. So here we have reduced the number of days spent in suspension and by how much. So let's see, that one is for, oh yes, for 6.1. So it says reduce the total number of days spent in out of school suspension year over year. I agree. I think, and that's an example. It is specific here because you could reduce them over year. And so to the point is if you had a drop of 1 or 2 from year over year, you would meet that performance measure. But I think it would be stronger to the reviewer to say by exactly how many, because that shows that you're really tracking and looking at the data and that you have a reasonable goal to support. And it should be more than just 1 or 2 suspensions if you're working across a whole set of schools or school district, right? It should probably be more than that. So you can show a little bit too about what you think is realistic. Oh, sorry, my mouse always keeps changing screens here. So Dave mentions t-tests may not be appropriate, should be changed in proportions. Yeah, there's a number of different analyses that you could use for some of these. And you don't necessarily have to do a test of statistical significance. That kind of depends on the capacity of your team, whether or not you have an evaluator who might be able to accomplish something like that. And you could use different forms. But I think that, even if you can just show a raw count change in any of these indicators, I think that would be sufficient probably for most of the grant reporting that we do. Carolyn, what are some things that you're seeing here in the performance measures that could be improved?
I think you guys have hit on most of them. I agree that the vaping from 25 to 5% is likely unrealistic. So I usually look at a 3 to 5% change. So not like actual percent, but from baseline, a 3% reduction in use over the course of a 2-year span. So that is what we've seen capable at the national level. So I try and And some of the national goals are related to reduction of use, around a 3% reduction. So using that as a baseline for any actual use percent, 30-day use rates among youth is always, I think, a good kind of, if you have no idea what you're capable of, 3% over 2 years is a good kind of baseline to use. I agree also the alcohol purchase survey. What exactly are you measuring? What are you surveying? So it says survey 36 stores in our community, but what are you at? What does the survey include? What are we seeing change? That didn't seem super clear. And then, if there is a way to, for 3.1 and 3.9, it says increase the number of parents who report that they monitor their child's behavior. It's a great measure, but from what? Or, do you have a baseline? If not, you can say from, year one, will be collected in year one baseline will be collected in year one. So over the course of the grant is what you want to see the change. So, yeah.
Yeah, some good examples there. We have just a kind of summary here too of thinking about things, and this will reiterate some of the things that have been shared already. For 1.3, making it an outcome. So maybe instead of just the number of stores you're going to survey, maybe you mentioned the number of failing stores as an indicator. So what you're saying is not just how many people stores you're going to reach, but you're decreasing the number of stores that are going to fail a alcohol purchase survey test on an annual basis. So having some way to indicate that. Talking a little bit too about improving the indicator. In this case, I think that, and it's not clear, obviously, to you all, so this was, I had additional context to answer this one. But you said at home may not be that important if they're also using elsewhere. And I think that there are sometimes we get a little too granular with our core measure outcomes, to get like, hey, what youth using a specific substance in a specific place at a specific time. In the context of the whole grant, that might not be quite as important. So sometimes you can take a bit of a step back from that and use maybe a standard 4-core measure here that looks a little bit about, for example, a peer disapproval of youth might be an appropriate one here, especially if your intervention is more peer-driven, or if you're a bit more parent-driven, maybe you're looking at parent disapproval. So those are some indicators that you might be able to look at. For 3.1, a little bit more details too about how many parents, like Caroline, you mentioned what's our baseline, what you're aiming for. 5.2 unrealistic, we mentioned that one. And then here for discipline, changing to the number of youth who would be suspended. So we have a bit more detail. So I think we hit all those good examples.
I do like your format here because space with the outcomes and performance measures is always difficult. So oftentimes I have seen where you end up rewriting the objective, which just takes up a lot of space. So by just using the objective number, it does put a little bit more on the reviewer, because then they have to go back and reference it to make sure it actually tracks. But this is super clean and clear and gets the point across as far as the performance measures.
Mm-hmm. Yeah, and there's lots of ways to organize it, and a lot of times it's learning the art of how to describe a lot in a very small amount of space, especially for those federal ones, right? Okay, awesome. So here's sorry, let me go back. Here's some ways of rewriting them. I don't think these are perfect, but I wanted to share them with you just as examples of things to think about, right? So for the alcohol purchase survey, a 15% decrease in the number of failing stores in the survey between a 23 baseline and 27. That's a way you could improve that one. In the program youth survey, percentage increase in youth reporting higher perception of risk from marijuana and prescription drug use. For you could have something like that. Percent increase in parents self-reported monitoring of youth and use of alcohol. What's interesting here is we're actually, by using the word self-reported, you're indicating also how it's going to be measured, right? So you're asking youth through a program survey, do they monitor their child's use of alcohol at home, which is important because it's actually really hard to measure anything for parents on monitoring outside of self-reported. So sometimes it's not a perfect measure, right? So it can be helpful too to indicate a little bit about how things are being measured here. And the other two kind of doing the same things as well, right? Okay, so let's continue to move forward here. We're doing okay on time. All right. Now, another piece of evaluation that comes up a lot that is not something that necessarily we talk about in examples so much is information that you want to provide in your evaluation section that speaks to things like protection of participants. So a lot of times you're going to be having people who are participating in programs and services. Maybe they are going to be, you need some type of consent form for them to participate in like an evidence-based program or in some type of activity that you're engaging with. And then you might also have consent forms for them to participate in evaluation, to take a survey, or to share other information about themselves with you. And what I wanted to do here was to share an example of a consent form, primarily because I think it hits on some of the different things that show up around participant protection. And it's something like a written document that you might submit with federal grants because they're often included in appendices. So I have an example here of a consent form. And note at the top here, this is not an example that I want you to go use. Consent forms, they're legal documents and whatnot. So if you need additional assistance from that, speak with a qualified professional or legal counsel when you're putting together your consent forms. But in any case, here's an example of one, right? And imagine that you're handing a survey. This is a survey that's asking youth about their experience in some type of evidence-based program. So imagine youth were doing something like Too Good for Drugs or Botfin Life Skills, something along those lines. And they are receiving a survey of a consent form afterwards. Now, I'm realizing as I'm doing this, because this is asking youth, I probably should use the term assent form here. And I know that could have been coming up in the critique here, but I'll just go ahead and mention that one right away, that we typically use the language of assent when talking about youth because they are not 18 years old. They typically cannot provide their own consent. It would be parents who do. So this particular assent form would be accompanied with a parental consent form as well. But with that detail out of the way, what are some things that you're seeing here in a consent form? What are some, or in the consent form here? What do you see that is a strength? What are some areas where you might have further questions? What experiences have you had when you're putting together some type of language before a parent or a youth or some member of the community participates in some type of data collection activity, whether it's a survey or interview or focus group? What would you want to see included or improved in this form example? Drop some ideas into the chat if you've got any. It can be hard, I think, sometimes with assent forms and consent forms because there's a lot of detail to them. One thing I'll mention too around consent and assent forms is also reading through it and thinking about ways that can be improved is that it can be hard to kind of develop a really strong process around having assent and consent forms set up for each of your programs. There's a lot involved with it. It changes for each different program or service you may be providing. And the language can be difficult and technical to think through. If you're serving populations that are not necessarily English speakers as their first language, you may need to provide translations of these consent and assent forms. So there's a lot of work to put into them. So it can be kind of a daunting task. A couple of things coming in the chat. Julie mentions require writing information beyond just a signature. I think that's interesting, right? So, you typically do want to have a name and a signature, in particular for the person providing consent. So in this case, it would be the parent providing a name and a signature and a date typically. And oftentimes it's helpful to have some type of contact information, whether it's an address or a phone number can be helpful so you know who it is and how to get in contact with that individual when needed. Amy mentions where it states there's no significant risk. I would clarify that it cannot be used against you. I'll clarify that point. I'm not sure if I fully understand that piece, Amy, but what I will say here is I'm glad you brought up the point around there are no significant risks. And I've seen lots of federal proposals come back both before a grant has been offered, but also afterwards during the implementation of a grant where a federal grantor may be reviewing your consent form documentation. There is nothing that you do in this field that has no risk. There is nothing. No matter how benign the survey may appear to you, there is going to be risk with it. If they're sharing information about themselves with you, particularly around things like substance use, as a minor, in most cases, their use would be considered using an illicit, something that's illegal for them to do. It involves risk. So things that you can mention, for example, are, risk can be about feeling uncomfortable or upset as a result of taking a survey or participating in a focus group. Risks related to the confidentiality being compromised in some way, where information about themselves gets into the hands of someone that shouldn't. So there are particular risks that are important to state and mention in your consent and assent form so that someone is properly informed and has the information they need before they decide to say yes about sharing information about themselves. Yeah, I think, Holly, you make a great example there too. From the participant's point of view, there are risks about sharing and having a sense of vulnerability, right? Talking about drugs and alcohol can be a challenging thing. Imagine, for example, someone's taking your survey on drug and alcohol use and they're living with a parent who is suffering from addiction. It can bring up a lot of really challenging thoughts, and having trained staff available for that youth when they're taking the survey might be a really important thing to consider. Brenda mentions, talking about things that come from the appendix. Yes, because we forget to prepare these items up front. Yes, I find lots of times that in the appendix, we sometimes do those in the last minute because we're thinking about everything else. And they can be pretty time consuming, so they're important to consider. Dave mentions that you might need an IRB for review. That's true. In some cases, not all projects will require that. Because to meet the criteria for an IRB review, you need to meet the standards for generalizable subject human research. Some projects do meet that criteria though and will want an IRB. And some may not necessarily meet the criteria for generalizable research, but they may want to have an IRB or an institutional review board to review something because they had great expertise around how to write solid consent and assent forms, and they will tell you exactly word for word what you need to include and not need to include. So if you're feeling like you're not confident as an organization about what your consent language should look like, writing funds in to hire an IRB to review your protocols for you can be a really good idea. Brenda mentions if you're serving underage participants, great idea to get permission. And Brenda, I'm actually glad you mentioned that, because who do you get permission from? School districts cannot provide consent on behalf of their students to participate in anything, in a program or survey or anything like that. Now, some school districts may, as a part of their consent procedures, be able to provide services to children. So, for example, if they provide consent procedures at the beginning of the year related to participation in after-school activities, you might be covered there. But that's, again, a situation where you're going to need to talk to someone who knows your situation well enough to know if that consent language would be consistent or not. But as an overall rule, only the parent or the guardian can provide consent for a youth under 18 to participate in something like a form like this. Now, there are some situations, and maybe some of you are familiar with it too, where we have a procedure of something that's referred to often as passive consent, where maybe you're doing a community survey at a school level, and the survey that you're administering is going to be administered to lots of youth across the school district. And what happens is you send home information about that survey, and parents then have an opportunity to opt their child out. That would be what that procedure is called. That's not possible in all locations. There are a number of states and school districts who will not allow that as a possible consent procedure. So again, you'll have to be familiar with your context to know if that's a possibility. But that might be a point that Brenda's trying to get at a little bit here too, is that you can try to include the school system as a member of your consent procedure. I have a few more details about the language specifically in the consent form, but I want to turn over to you, Carolyn, if you have other thoughts about consent, assent forms and whatnot with some of the grant writing work.
Yeah, so oftentimes if you're implementing an evidence-based program and it has a survey attached to it, those surveys often have the consent forms or assent forms. So it helps to just use what is provided when you purchase the EVP, because then you don't have to kind of come up with the language. And even some of the larger EVPs or more widely used EVPs will have it in multiple languages, et cetera. So definitely would rely on the programs that are out there to use their consent or assent forms. I do think that thinking about it in multiple languages is an issue in some communities. And then doing programs in schools and or doing surveys associated with those programs in schools is increasingly challenging in, I mean, ultimately, particularly southern states, which is what this PTTC is serving. So I think this can be something that really needs to be thought through ahead of submitting grant applications, is how are you going to do an evaluation that is consistent with the laws and rules, both statewide and then in your locality.
Yeah. Yeah, I think great points all around. And a few things that I'll mention in here that you may want to include on consent and assent forms. Just these are some typical things that I like to see. Again, this is not a comprehensive list, and you want to have additional expertise before you kind of answer that. But I think it's important to say about how long it is. So is it a 5-minute survey or is it a 50-minute survey, right? Is it a 10-minute interview or is it a 40-minute interview? So having some length around that is important. All surveys have risks, so state risks with taking the survey, what you anticipate those to be and what they should anticipate. Sharing also what personnel information you will or won't ask. And this includes if you're asking for personal information, like for example, names or addresses, which in most cases I think you probably don't want to ask for. But even if you're asking things that could indirectly identify someone, like their gender, their race, their grade level, if that information is combined in such a way and the context is understood, you might be able to identify who that person is. Or if you ask for job occupation, right, and they say county commissioner, you might be able to identify who that person is, right? So that's important to share. You know, what is it? What is the information that they are sharing with you, and even including those things that could indirectly identify them. You want to share information about how you'll protect data. So what procedures will you do to keep data confidential, and what procedures are going to involve with that. And then also, how can someone withdraw from participation if they would like to. So those are some things to include. There's probably more, and in each individual circumstance, depending on the nature of your survey or the program or service you're offering, you may need to add more additional details. But these are just some things to be thinking about with consents. And I'm so glad, Carrie Lynn, that you mentioned the situation where you could just simply use the one that the evidence-based program has, because they've usually done a lot of this work and thinking on your behalf. So if you've got a strong EVP that's got existing consent language, I think it's a good idea to use that and to submit that. And sometimes you don't even have to submit the examples of the survey with your federal grant. If you just say, hey, it's going to be the survey that's with this well-known program, you don't even have to submit it because they say, okay, we know that that's a well-established and validated way of measuring. All right, so let's move on to budget. So here we have an example of a budget. And I know you don't have the whole context here for this case. Actually, Carolina, maybe if you want to provide a little bit of the context for this one, that would be helpful to kick people off and see what they can try to take a look at and what they see as areas to improve and areas of strength in the budget here.
Yes, so this is using the SAMHSA forms for budgets, as you can see at the top, at the kind of second half of it. And this is for a proposal for the STOP grant, which is specific to alcohol, and it is for coalitions. So when you look at some of the language, if you're familiar with the coalitions and the work that they do, it will be obvious, I think, some of the areas where it could be improved.
One thing I'll mention, and this came up in some of the previous workshops too, as you're reviewing the budget here and looking at ways that sections of it can be improved, is that I think some of the areas where I see the biggest misalignment is between budget and the narrative. Because sometimes, and this may be true in your organization, the person who's in charge of your finances may not have been involved in all of the nitty-gritty details of the grant writing team that was putting together goals and objectives and what you're going to accomplish. And so there may be a bit of an understanding gap between those two positions. So it's always so important to make sure that the conversations you have with the person who's writing your budget is able to really understand the nature of the program. As we wait for a few more comments to come in, Carolyn, do you have any examples or general things that you've seen commonly when either reviewing grants or supporting others who are putting them together? What are some things that are common hiccups that we run into when writing our grants and grant narratives?
Grants or grant narratives or budget specific?
Sorry, I meant to say budgets and budget narratives. Thank you for catching me on that.
Okay, got it. Yeah, so I agree that the biggest issue that I see is the perhaps disconnect between the narrative and the budget, because oftentimes the narrative takes a lot of time to write. So, and you can't really get working on the budget until you have the narrative complete. But oftentimes people start working on the budget because you feel like, oh my gosh, we've got to get it all done and submit it in time. And then all of a sudden it's like you've made a tweak to the narrative where you've added a personnel or you've added a outcome, but then you haven't added that into the budget. So there's this mismatch, or you're using different language in one. You're calling it the program one thing or the position one thing in the narrative and something different in the budget. And so then it's really hard for someone reviewing the two documents together to figure out what you're talking about.
Yeah, so those are great points. And I feel like that's the same thing too. It's so hard because, you know, we talked about grant writing as a both linear and circular process in a sense that it needs to flow and have alignment from start to finish, you know, starting with your problem, figuring out what your strategies are going to be, and then having your budget aligned to fund those strategies. But we know that we're kind of working circularly because as the second you get started, you know, well, we're going to probably need to fund some staff and we're probably going to need to fund this. And you want to be talking with that budget person early on to at least start drafting things out. But then also make sure that they get a chance to do a final review at the end so that there wasn't a change made. And, oh, we decided we weren't going to fund that position, but it's still there in the budget, right? That certainly happens. Dave makes a point here about in the narrative about how much per hour, et cetera. Do you want to speak to that one a little bit, Carolyn?
Yeah, so I think that if you just look at this page, and again, it's travel as the topic of this section. The first piece says under purpose says mid-year. Well, given that this is the STOP grant and they are typically DFC coalitions applying for the STOP grant, you would make the assumption that the mid-year is the CADCA's mid-year institute. But then when you read the travel narrative, it's events to accommodate large number of attendees and invite motivational speakers. So it appears that maybe it's a local item, and then why the costs of the travel don't necessarily align. You've got quantity per person. It is very, that line in particular is unclear. The second one is campaign. A campaign isn't a travel expense, so that it seems that it's in the wrong section of this application and should probably be in, you know, supplies or some other section, not necessarily travel. And then the educational trips need more specificity. Like, what exactly are they paying for? Is it per hour? Yeah, I need to detail how they arrived at the 10,000 for the educational trips. Like, what metrics were they using? Are we using mileage? Are we renting cars? Are we going by train? What are we doing? So.
Excellent. Yeah. Great examples all the way around. We'll go through another one, and instead of opening up to everybody, Caroline, I'm going to have you just walk through this one, some examples, since we're running a little low on time. So go ahead and kind of walk us through this section of the budget. What are some things that you would change or see differently?
Yeah, so this is the supply section, and you'll see here the students-led activities. They have in here that it's breakfast and dinner are provided, but in federal grants, food is not an allowable expense. So you need to remove that from the narrative and definitely not included in the actual budget. And then the mental health fairs definitely there's a place where you can make the connection between mental health and substance use, but because this is a stop grant, it's specific to alcohol. So you definitely need to make the connection of how the mental health fairs are going to address underage drinking or alcohol use among youth. And that's not clear in that narrative under number 3.
Yeah. We have a question coming in from the chat too, there, Carolyn, about having like a cushion or an over on your budget. Can you speak a little bit to that? Like how, when you're not entirely sure what to request for, how do you handle that?
So I'm not entirely sure I understand as far as over budget, but if it says they will fund up to 200,000, you should not submit a proposal that has anything above 200,000. So it has to fit within your request cannot be above what they say they're going to fund. But within sections, if you are not entirely sure how much you're going to pay your newest personnel, do your best guess. There is definitely room after the award to make small adjustments within budget categories. So the company's budget.
So I think, I think what Chelsea's asking here is, can you submit like some annual financial statements from your organization in lieu of a budget? And in this case, I would say certainly for federal grants, no, because what you're doing is you're saying how is specifically the amount of funds that you're going to be getting from the federal agency going to be used in a much more detailed level. Now, there are some funders who are trying to provide more general support, maybe are willing to provide more capacity and unrestricted funds that may just want to look at a financial or budget. You see this a lot in more peer-to-peer fundraising and working with individual like family foundations and things like that, where you may be able to provide a budget. And that sometimes the question is really more looking at what is the financial health of your organization as a whole. But I think typically for these federal grants, you really want to go line by line of how you're going to use the funds that they give you.
And one last thing related to budget and numbers is if you have to provide a match and they say it's 100% match, only put in 100% match. Because if you put in 105% match, even though you're not required to do 105% match to be awarded the grant, you will be required to meet the 105% that you put in that proposal. So only tie yourself to what is required so that you're not finding yourself like trying to come up with this extra, $5,000 in my example when it's completely unnecessary.
Yeah, that's a good point in detail there. We are just about here at the end, but I'm going to go through a quick example here about letters of commitment. And I spoke about this in one of the previous workshops, so you can kind of take a look at that too. But the example here is when you're looking at your partnerships, in this example, to try to really look at what organizations are going to commit to do and what they're going to pay for, how funding is going to be shared, looking at descriptions of accountability. So like what's going to happen when the work is done, and not getting too over the top in your language, right? So about how great an organization is when they're doing a partnership or supporting or providing a letter of support. But you'll find more details about this in the toolkit that you can review after the workshop as well. And then an example on a workshop, but I think we need to get to the end here because we are right about here at 2 o'clock where we're going to wrap up. Kristen has just mentioned in the chat that we have a link to prior sections, and then we also have a link to evaluation. So Kristen, maybe I'll turn it over to you as we come to a close here today to wrap us up.